So, good morning, everyone. We are Group 7 from Uppsala University in Sweden. As you might know, a pandemic has taken over the world, making most countries react with lockdowns and strict measures. Meanwhile, in Sweden, strategies have been slightly different. In Sweden, no lockdown has been introduced, meaning we are still allowed to take walks outside. Use of public transport is allowed, but not recommended. And we cannot go to pubs and bars with a group of more than 8 friends, just to name a few of the government recommendations.
And even with light restrictions in place, the effects of COVID are palpable. People above 65 are recommended.
Restrictions in place, the effects of COVID are severe. And Agnes, we interviewed an 82-year-old lady who has said, "It feels like you don't know when it's going to end. It feels like my last Christmas." So after talking with her, we assume there are multiple negative applications of the restrictions in Uppsala, like the ill mental health, loneliness, the deteriorating physical health in response to poor mental problem. And if loneliness is so severe a problem, we have to do something.
We are excited to introduce the Grand Pulse system. With this program, we aim to connect the elderly population of Uppsala, those who might be particularly vulnerable to loneliness, by pairing them up with a student that matches their interests.
We are using Uppsala's unique student structure to set up the Grand Pulse system to help people like Agnes fight their fight against not just COVID, but exclusion from society. So how does the Grand Pulse system work? Agnes signs up on the website where she will list her preferences for the student she is looking for, her objectives, her ideas, and priorities. Should Agnes not be able to sign up online, there's a telephone number she can call and do the same application over the phone. This is a customizable experience, of course. The student unions and the Uppsala municipality will work in conjunction with us to make the best student-Agnes match.
And then we come in. That means you, the student. Our job is to get in touch with Agnes. And well, how do we do this? Well, for now at least, call, FaceTime, or use WhatsApp. Just get in touch. And with our feedback monitoring system, we ensure a smooth process. The Grand Pulse system caters to the needs of 2 parts of society that were heavily affected by COVID, via students and the elderly. So how does this benefit the elderly?
The Grand Pulse system not only tackles loneliness, but also exchanges ideas and engages in, albeit limited, social intergenerational interaction. And what does this do? In the US, a research article was published on the behavioral change of senior citizens interacting with university students. It discovered that there was a positive change in the attitude within both the students and the seniors. Overall, there's a lot of research out there that supports this Grand Pulse system. It works.
And why would we, as students, between the millions of deadlines and assignments, want to engage in this program? Well, first of all, me as an Uppsala student would get points in the housing queue. And secondly, the university would give me a certificate, which is a nice thing to put on my CV, and would look good in job applications, especially because of my field of interest is healthcare.
And finally, social awareness. In creating this bond with the Grand Pulse system, we're also creating a mutual understanding of each other's needs. Agnes would not be my grandmother. She's not your grandmother either, but we would learn to be responsible to protect her too. And what would this enterprise cost? The Grand Pulse system is not for profit. It is a community effort pooling on resources available to support those who struggle the most. We've broken down the costs into 2 parts. The one-time starter costs, which includes PR, advertisement, and any unforeseen costs. And this would be around an estimated 700 euros. And then there's the monthly recurring costs, which is website and administration. Based on our estimations, that would be around 500 euros. The initiation of the program,
1 minute left.
The initiation of the program would base itself on readily available systems, such as the student union Wi-Fi and any personal computers.
After getting in touch with the stakeholders, such as the student union and municipality, they offered their support in marketing of the Grand Pulse system. So in conclusion, our Grand Pulse system can be shaped and developed into many different settings and programs all over the world. The program has the potential to address the whole population and not be limited to elderly and include outdoors activities. Looking beyond COVID, the Grand Pulse system fills a long time gap we never had reason to address until now.
A Grand Pulse system prototype is easy to set up, easy to use, and easy to implement. As long as there are willing students, the Grand Pulse system is here for companionship and support in times of need.
Thank you.